welcome to our monthly Gero Echo. My name is Sarah Tompkison. I'm a social worker on the Geri Echo Hub team, and joining me this afternoon on the team is also uh, Chris Vale, physical therapist, Dr. Rita Bell Fernandez, Dr. Reese Ueno, pharmacist, and we also have Miss Tracy Romualdo, who is a social worker. Um, just a little bit of housekeeping. I need to remind everyone that this CME activity is jointly provided by the Queen's Medical Center in conjunction with the University of Hawaii Jabsom Department of Geriatric Medicine. We're really excited to share our collective experience and wisdom and to learn alongside you. As a reminder, there are evaluations that are required if you want to receive CMEs. You can find these evaluation forms at the end of the presentation. They'll be available in the chat, or you can always follow our link, the Geri Echo link, if you want to complete the evaluations. CEU, or I should say continuing medical education, is available for physicians, DOs, RNs, APRNs, and physician assistants. We're also offering NASW CEUs this month for social workers and certificates of attendance for CNAs and students. NASW will send out monthly certificates, monthly attendance letters after you've completed the evaluation form. With regards to the other providers, you will receive your CME records by Queen's Medical Center in mid-January of 2025. Again, we value your comments. They're so important to us because it not only helps with the planning committee as we look at future programs, but it's really helpful feedback for us too on the topics that we've chosen. This ECHO webinar is a forum of mutual teaching and learning from experts, and each of us are on the front lines. So as the ECHO motto goes, all teach, all learn, in the spirit of aloha. We encourage you to please turn on your cameras to help us build this community of learning. If you haven't already identified your name, behind your name, if you can also indicate what your professional title is, that will be helpful. The format for this afternoon's webinar consists of a short lecture from our presenter, followed by open comments from the expertise of the hub members I introduced to you earlier. Participants, your comments, your questions, even case examples for discussion related to the topic is very helpful for all of us. Additionally, we invite you to share any geriatric cases, but please keep in mind that this needs to be HIPAA compliant, and this includes not sharing the patient's name, birth date, address, and so on. We learn best from our patients and our clients. They are our best teachers. And so without further ado, it gives me great pleasure to introduce our very experienced speaker who's on mute. Martha, you're on mute. I'm going to
Yes.
introduce you. So,
Yes.
so Miss Martha Coughlin is currently the managing director for gettoinsurance.com. She really is a Medicare subject matter expert. She has a syndicated radio show host for Medicare Conversation with Martha and a Millennial. She's published in the American Radium Society Journal and recently with the International Journal of Radiation Oncology. Martha is also a licensed general agent and financial planner and conducts quarterly Medicare pre-retirement workshops for several companies and nonprofit groups. Prior to transitioning to the healthcare industry, I wanted to mention that Martha worked as assistant vice president for the Bishop Trust Company as a trust officer with First Hawaiian Bank. She is also a former vice president with Morgan Stanley and Dean Winter Reynolds in Manhattan. She is married and has 2 children. She enjoys sailing and reading. Take it away, Martha.
Thank you so much. And thank you so much, Sarah, for inviting me and John for getting me set up properly, and I think with my my slides there. Now, I want to thank everybody for attending. I think it's so important to get foundational information about Medicare. I love this subject so much. So when Sarah invited me to present, I was just excited. Now I have 40 slides and I have 20 minutes. So I'm going to go through the slides very quickly, but please take down your questions. So if I can answer them after session, I'm more than happy to do so. So today we're going to be maneuvering the Medicare maze, A, B, C, and D. And something I've been doing for 15 years and just love it. Next slide. So of course, anything that I say should not be taken for guidance. It's for informational purposes only. And of course, I'm required to share that with you. And if you want more information, you should follow up with Social Security or Medicare. Next slide. So I can't see the slide. So if you're turning 65, retiring, or losing your insurance, a lot of people don't know where to go or what to do. There's a real transition when people are moving from employer coverage to Medicare. There's a serious knowledge gap. And for many providers and practitioners, you might be in the middle of treatment and someone has changed their plan, and all of a sudden you cannot get the pre-authorizations and you cannot continue treatment. So it really is important to know what resources there are available for your patients and also for physicians. Next slide. So what is Medicare? Everybody believes they know what it is. And this is a very basic definition. It's a federal health insurance program. It's run by the Centers for Medicare and Medicaid Services. Benefit decisions are controlled by the U.S. Congress. I always tell people that because when Medicare beneficiaries want to know, why isn't my tummy tuck covered? It's because Congress gets to decide what they cover, and tummy tucks is not something that they approve. Also, I get a lot of calls from people who tell me, Martha, I was ready for Medicare. I called Medicare and they sent me to Social Security. A lot of people do not realize that in order to get set up for Medicare, you have to start with the Social Security Administration. They handle enrollment and eligibility. So you can already see the confusion starts right at the beginning. Next slide. Here on the next slide, a lot of people tell me, oh, Martha, there are thousands and thousands of Medicare options. How do I choose? But the reality is that there's really just two paths that you can take when you're ready to get covered by Medicare. The first path is, you have original Medicare Part A, original Medicare Part B. You, of course, should and can decide to get drug coverage with that. That would be Part D. And then also some people can choose to add a secondary coverage known as a Medicare Supplement Insurance Plan, or Medigap. That's one way that people can get Medicare. The second way is through what's called a Medicare Advantage Plan, or Part C plan, which combines the A, B, and many times the D as well. And that is another way to get Medicare. So there's really only two options. Where you start looking at there's so many is because there's different insurance companies that offer Medicare Advantage Part C plans. There's different insurance companies that offer Medicare supplement plans. So it's really not thousands and thousands, because Medicare also determines what plan you can sign up for based on your zip code. So if you have a zip code in Honolulu and you're looking at, for example, a United Healthcare plan, that plan might not be available on the Big Island. So a lot of people are confused because they don't realize some of these basic rules and laws covering Medicare. Next slide. Okay, so there are four parts of Medicare. So Part A is an apple, covers hospital insurance. And Part B, the medical side, covers doctor visits, lab. Part C is when it's sponsored by a Medicare Advantage plan, private insurance company. So someone has elected to get their Medicare through this private insurance company. That's where that Part C Medicare Advantage plan comes in. Can you guys hear okay? Is it too much static? Hopefully you guys can hear. And then there's the Part D Medicare prescription drug plan that people can pick up if they don't choose a Part C plan. Now, let me just say briefly, if somebody has a Part C plan and they choose a Part D plan, that Part D plan is going to kick them off of the Part C plan. So they'll have original Medicare A, original Medicare B, and they'll have the drug plan, but they don't have the extra benefits and lower cost sharing that comes with the C plan. So this is a major pain point. Some people are watching late night TV, they change their plan and don't realize by signing up for a Part D drug plan is going to kick them off their Part C plan. Next slide. This is just an example, really small print, but I just wanted to show an example of a summary of benefits for a Medicare Advantage Part C plan. These plans may have a 0 monthly premium, 0 for preventive services, and also a maximum out of pocket. So, of course, you can get this in Humana here locally, WellCare Ohana, Akamai Advantage, Kaiser has a plan, Aloha Care has a plan for people who have both Medicare and Medicaid. But I just wanted to show this as a difference when you look at the Medigap, just to show you that a Part C plan has these additional benefits. They have different copays than original Medicare, because this is another confusing point for people. People will tell me, oh, I have Medicare. And I say, oh, what Medicare do you have? They don't know that there's a difference between original Medicare and a Medicare Advantage Part C plan and a Medigap plan. I've also had people who go to the doctor and they show their red, white, and blue Medicare card. They don't show this Advantage plan card, and then the billing gets all screwed up because there's some people who think if they show the doctor's office a red, white, and blue card, you automatically will know if they have other coverage, and that's not the case. Next slide. What is Medigap? A lot of people, have had the two major insurance companies from birth, through parents who were working. They had, family coverage, and they had one of those two major plans that we have here, of course, HMSA and Kaiser. Those two insurance companies do not offer Medicare supplement plans or Medigap plans. So some people don't even know that they're picking up a Medicare Part C Advantage plan. They think it's a Medicare supplement plan. But a Medigap plan is actually a plan where they cover whatever Medicare A and B doesn't cover, they pick up the gaps. So the strongest plan, you could pay a premium for this Medigap plan and never have any copays out of pocket for any additional care. But this does not cover drugs that you pick up from the pharmacy. So when you pick up a Medigap plan, you also have to pick up a separate Part D plan. The reason I wanted to share this is because, again, people get mixed up between Medicare Advantage, original Medicare, Medigap. There's all these different types of Medicare options. You cannot have both at the same time, but many people think an Advantage plan is a supplement plan. Next slide. This is the table that shows the copays for Medigap Plan G. Now with Medigap, there's not parts. Remember when we talk about Medicare, Part A, Part B, Part C, Part D, when it comes to Medigap plans, Medigap plans, it's Plan A, Plan B, Plan G, Plan F. So Plan G is the plan that became available for people who turned 65 after January 1st, 2020. People in this option do have to pay an annual deductible for Part A and Part B benefits. But once they do that, everything else will be zero for the rest of the year if it's medically necessary and Medicare approved. There are some people who turned 65 before January 1st, 2020, and they were able to pick up a Plan F as in Frank. And Plan F as in Frank, you're not responsible for the deductible. So you show your Medicare card, you show your secondary coverage, you're all set. So for people who have, I just had a case yesterday. Someone called and she wanted to set her mother up into a Medigap plan because she heard that if she picked up this plan, even though she has to pay every month for the plan, a lot of the treatment her mom needs would be zero. However, in the state of Hawaii, a Medigap plan, you have to do underwriting if you're not within a certain period of time. That certain period of time is within 6 months of turning 65 or leaving an employer plan. So she has to answer a lot of questions. And the very first question that, allowed her not to go further, her mom is getting dialysis. So if a person is beyond the guaranteed issue period in the state of Hawaii, they're getting dialysis, they don't qualify for this very rich plan that will give you all zeros. So again, a lot of people get so confused and they think, oh, I thought when I was signing up at age 65 that I was getting the supplement plan. No, if you were paying zero for your plan, it wasn't a supplement plan, because supplement plans always have premiums, because Medicare will pay first. Got to still pay your Medicare premiums. The Plan G in this case would pay second, and that's how you get the zeros. So these plans work very nicely for people who can afford the premium and also may have a lot of health issues and want to be able to, have zeros, and more importantly, go out of state for services without a lot of hassle. I had a couple, and both of them were diagnosed with cancer within 6 months of picking up their Medicare coverage, and they decided to go with the plan F in their particular case. And they called me one day and they say, Martha, we love you. And I go, why? Why you love me today? And they said, because both of us had this treatment for 6 months at Stanford. It was 44 pages of hospital bills. And the only page that is important to us is the last page, which says our out of pocket is zero. So these plans definitely make sense for some people, but these are plans that you don't hear a lot about. Next slide. Okay, there's differences between Medicare supplement plans and Medicare Advantage plans. So I'm not going to go through the whole thing. But again, this is where a lot of people get very confused. They want to know, how come I have to pay so much for services? Well, I had a person who needed dialysis, and he was on a Medicare Advantage plan. And yes, every year he had to pay out of pocket until he reached his maximum on the Medicare Advantage plans, because they do have a maximum out of pocket. But a friend who chose a Medicare supplement plan, and the person still on dialysis, he had all zeros. So there's major differences between supplement plans and Medicare Advantage plans. So that's why it's important not to confuse the two. Understand that they pay differently. And if you pick up a plan that has copays, well, you'll have copays for certain services. The other reason that some people, like the supplement plan is because once you reach out to Medicare and you get the pre-authorizations, you don't have another level of bureaucracy with the insurance company that sponsors the Medicare Advantage plan. But we have clients that have both Medicare supplement plans, Medicare Advantage plans, and they both work well. So it's just about really knowing what plan you have and understanding how to work to get the best out of it. Next slide. So pain point. When do you learn about Medicare? And where do you pick up the knowledge? Who knows? Next slide. So you qualify based on age or if you have certain disabilities, but you also qualify if you've been married to someone who paid into the system for 10 years. Paid into the system for 10 years, and you've also been married for 10 years. You actually qualify for Medicare under a spouse's work record, even if that spouse is deceased. I bring that up because I have some people who are from another country, but they married someone in the US. And even though they may never have worked, I had this one person, she wasn't seeing a doctor. She wasn't going to the hospital at 72 years old because she didn't think she could qualify for Medicare because she never worked here, but she qualified under her spouse. But you have to call Social Security and tell them that you were married for 10 years. It's not an automatic process. So if you ever find someone who's in that situation, ask if they were married. Maybe it was some time ago, but if they were married for at least 10 years, they can qualify. Next slide. Okay, so you start the process at Social Security. So you want to tell people if they need to sign up for their Medicare, have them call Social Security. The number is there, 1-800-772-1213. If I make it to the end, I do have local numbers as well, but that's the toll-free number. Now, you do that to get this card. This is the Medicare health insurance card, but there's still one more critical step. Next slide. Next slide. Yep. So in order to determine if you need to enroll, you have to ask yourself questions that most people don't even know to ask the question. Do you have employer coverage under your own employment or a spouse's plan? Does the employer you have does the employer you have coverage through have 20 or more employees? Who would think that that matters? If under 20, do you have a small employer exception or contract with a professional employment organization to secure your health plan? That could be pro service, that could be Altres. There are different rules that apply if you're under those situations. Next slide. If you answered no, you are required to enroll into Medicare at age 65. Medicare will be primary, and any other coverage will be secondary and only pay claims after Medicare. It is the Medicare beneficiary's responsibility to know what rules apply to their specific situation and enroll timely to avoid penalties and gaps in coverage. Now, I want to share that 2 weeks ago, I was invited. 2 weeks ago, I was invited to a Medicare potluck. A group of doctors invited me to their home, and they everybody brought something. Oh, one doctor brought this pineapple upside down cake, which was so delicious. Anyway, this so I'm doing this little presentation to about 20 people. So I mentioned that if you have coverage through your employment, but it's less than 20, and you don't have a third party negotiate, you don't have coverage because Medicare pays first. The employer coverage would pay second. So this doctor was looking at me really weird. So after I finished my presentation, he said, I'm still working, and my friend told me I don't need to apply because I'm still working. I said, but is your coverage under that job? He said, oh no, I'm covered under my spouse who retired from the state 3 years ago. I said, sir, you don't have coverage. He said, but I have a card in my wallet. And I said, okay, call up on Monday. He called on Monday, and I will tell you, they are now my best friends because this gentleman, 5 years old, found out he has no insurance coverage because he did not pick up his A and B. So I gave him all the paperwork. This is what you got to do. Go over to Social Security, so he'll be okay. But to this day, it's not come in yet. It'll be another month. He has no insurance coverage, and he had no idea. And he just can't even believe it. But they're my new best friends, and they already invited me over for dinner again. Next slide. Next slide. So pain point. Some people 65 or older become ill when working. They lose their job. They lose their health insurance. Their family and friends have no idea what to do. No idea. With no authorization on file to disclose to a family member or friend, nothing on file, they cannot even get any information. So we've gotten calls. We work with the Queen social workers. We get calls from people in the middle of cancer treatment, and all of a sudden, no more health insurance. So we try to figure out what's going on, and we've had, I have to say, we've been successful 10 times out of 10 in helping people who would have perished if they were unable to get the insurance straightened out, and we were able to help them. And the thing is, people don't understand. People say, how much do you get paid for doing that? There is no one who pays anyone to help you figure out what you need to do with respect to Medicare. There's no one. So I do it because I love people, and I do it as a community service. I'm so happy I have this knowledge so I can help people who are in very, very dire situations. And we've been very successful. So that's why I get so pumped and excited when somebody wants to talk about it. So I just have a few minutes. I'm just going to cover a few more slides, and then we can open up to questions. So next slide. So who needs to enroll at age 65? Solo practitioners in the field of law and medicine and self-employed are often unaware of the requirement to enroll into original Medicare Part A and B. They falsely believe that they do not need to pick up Medicare because they have employer-sponsored insurance. So let me say that again, okay? If you are not getting your coverage through a third party and you're running a small office, less than 20 people, you are required to get Medicare Part A and B. The way that will be tested for you is my last story. I had a doctor. His son came to a workshop I did. The doctor was 89 years old. So he had employer coverage. And one day the insurance company calls and says, doctor, are you still working? So he said, well, I take care of my friends and family, they said, "Doctor, we need to see payroll. We need proof that you're still working so we can continue to offer the employer coverage." So, of course, he was not working. He was just taking care of family and friends, like he said. So they said, "Well, doctor, we have to end your insurance." So he's like, "Okay." He went to Social Security. Social Security said, "You missed the enrollment period. You have to wait until another 8 months to pick up your Part B, and you're going to have a penalty of 250% of the Part B premium." So they didn't know the son. Nobody knew what to do. So the son came to my presentation, and then we met after, and I was able to call the insurance company and beg them. I'm telling you, I begged them, please keep him on the employer plan until we can get the Medicare straightened out. And we were able to get the Medicare straightened out in about 2 months. But the reason that you might say, why did the insurance company call this doctor out of the blue, is because he had to take a medication called Opdivo. It was $16,000 per month. Every 2 weeks, 8,000, 16,000. No, it was 16,000 every 2 weeks and 32,000 a month. So the employer plan started to look at this. They noticed he was 89. They did not have Medicare primary, so he had to get his Medicare. Then they were telling him about the rules. So I was able to find a little workaround, and we were able to straighten it out. But this doctor, 89 years old, would have been paying $32,000 out of pocket, plus his other costs, because he did not sign up for Medicare, and he thought he was okay because he had employer coverage. So that is, I guess, the most important things that I wanted to share with you today. There's other stuff, but please ask me questions, and you can always follow up with me later. So we can go ahead and go right to questions. You can go to my last slide if you want to for information about resources like Medicare. It would be the last slide. Keep more. Yep, 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 yep. More. Few more. Few more. Few more. Few more. That's it. That was it. The one before that. One more before. One more before. One more before. That one. So those are the numbers for the Honolulu Social Security office. I encourage you to take these numbers down. 1-855-572-4879 for people who live closer to Honolulu. A Kapolei office is 1-855-572-4866, and the national number is 1-800-772-1213. So those are important numbers that you can, provide to people if they need more assistance when something's going wrong with their Medicare or Social Security.
Okay, well, thank you so much, Martha. I'm Lucas. I'm a psychologist and on the Geri Echo team, and I'll be helping kind of facilitate our next phase today. And just wanted to say, wow, like you are a gem of knowledge and wisdom.
Thank you.
And I think this is an area that we all cringe at in our respective situations. But yeah, wanted to first open it up to our panel and see if folks from our different specialties have anything to add or ask. So, Sarah, from social work, any thoughts or questions from you?
Yeah, I think this is perfect timing because it's open enrollment period next week. Is that right, Martha? October
Yeah.
the 15th to December 6th or so. So,
December 7th.
7th. Oh, yeah. So it's really timely, but Martha and I were kind of emailing each other offline, and what I think is going to be helpful too is I forgot that a lot of providers here in the audience, if you're a licensed clinical social worker, if you're a psychologist, anyone providing mental health services, you can also bill Medicare Part B. There are certain CPT codes, and Lucas, maybe you may know, you can speak to that as well. But I think that often is overlooked when we think about the fact that a lot of people that aren't seeking treatment for depression, Martha, or anxiety don't know that this is available. And but what we also found out that I think starting next year, there's another, is it the caregiver training? Oh, you're muted, Martha.
Oh, yes, I'm here now.
Yeah, so there's a new program that's going to roll out next year that provides actually reimbursement. There's a code for that also, that allows providers to offer individual and group caregiver training to the Medicare beneficiary under Part B. Is that
That's
what you
right.
understood
Starting
too?
July 1st, 2025, there's a program here in Hawaii that will be offered. So look for more on that July 1st, 2025. But yes, they did. Medicare decided to approve that training.
That's great. Sounds like a super helpful resource. And Rita Bell from Geriatrics, any questions or
I
comments?
I want to thank Martha for her beautiful heart, for helping that doctor, for helping my patients at KKV. As you said, you've come out to our seniors with the Marlita's exercise group, and we love you. Thank you, Martha, for everything. And I wanted to share with the people on the panel that Aloha Care, I'm now medical director of population health at Aloha Care, and it's an insurance for Medicare. It offers Medicare and Medicaid. So if you have low income seniors, this is a plan that they can get on Medicare after 65.
Yes.
Thanks, Rita Bell. Thank you. And that's, as we know, older adults are some of the lowest income populations in our communities, and so that's a huge area of importance for support there. Reese, how about from pharmacy?
Well, from pharmacy, what I see sometimes at the pharmacy is patients, when asked to see their insurance for drug coverage, they'll bring out their red, white, and blue card with just A and B, and
Exactly.
then that's sometimes they learn that they don't have the Part B coverage, or I try to look at their other cards, to see for what else they may have that may cover drug. And luckily at KKV, we can always send them to the eligibility department, and then from there they can get connected, to get coverage for their drug plan. But I had a question about Medigap supplement plans. Do all doctors or clinics or facilities accept that supplement plan? Because you mentioned, I guess some patients get all zeros across the board. Do they have to go shopping for a new doctor sometimes, or is it automatically covered and work for all patients in Hawaii in particular?
Thank you for that question, Reese. It's a great question. I also want to say Aloha Care has wonderful people. So for people who need Medicare, Medicaid, that's a great plan. But to your question about Medicare supplement plans, also known as Medigap plans, a doctor who takes original Medicare, if they take original Medicare, they typically, it's not an issue because what the supplement plan is doing is coming in as secondary coverage. So the doctor doesn't have to present a claim. As soon as the supplement plan sees that original Medicare made the payment, the supplement plan is supposed to pay those charges. And I know it works because I had a client whose husband was in the hospital for 500 days. She was presented with a bill for $1.2 million. That's why I get so excited about this stuff. So she said, "Oh my gosh, Martha, what happened?" So it turns out the hospital knows that original Medicare covers the 90 days in a benefit period, then the 60 lifetime reserve days. So after day 150, they're like, "We're not going to bill Medicare because they're going to deny it." But because he had the supplement plan pays an additional 365 days. So the hospital needed to bill Medicare, get the denial, then the secondary Medigap plan would come in and make the payment. So I had to actually call all the parties and say, "Hey guys, please bill Medicare. Yes, you will get a denial." And then that bill was covered in full. But can you imagine this? She's also a doctor. Her husband was a doctor. She almost passed out when she saw the bill for $1.2 million. So these challenges that people have are real. And it is important to really understand how to resolve them, but no one gets paid to do that. So that's why, there's like a little bit of a disconnect with it. And sometimes, it's very difficult. But doctors certainly have a choice whether they want to take Medicare or not, or take a patient or not. But if the doctor takes original Medicare, the supplement is really coming in secondary. So, it's up to each doctor, but I have not heard of any problems uh, um, in the last 15 years that I've been working with people who have both plans.
Wow. Thank you. Thanks, Reese, for the question. And Chris from physical therapy, how about you?
Luke is
Currently
unmuted.
looking for the unmute button, it looks
Oh,
like.
okay. No
Um,
worries.
if you can't find it, Chris, and you have something you want to add, you can throw that in the chat there. I can see that. And in the meantime, Tracy, welcome. And how about from you, from social work?
Sorry, I was having challenges too. Thank you, Dr. Murphy. That was such a great presentation. I find that no matter how educated or how, what socioeconomic status a person is in, Medicare is such a mystery. And unlike you, most of us are confused by it and, just get overwhelmed by it. And so thank you for what you do. My question is, some of the residents here do have secondary insurance, and some even have tertiary insurance after Medicare. Do you find that is often the case here in Hawaii, or is there a lot of people who don't have any, Medigap insurance or anything else? Do they come to you?
Right. That's a great question. So there again, you can either have a Medicare, original Medicare, and you can add the Medigap in a separate drug. That's one way. Or you can have a Medicare Advantage plan. You cannot have both. So in Hawaii, we have over 250,000 Medicare beneficiaries, and about 125 to 150,000 have Medicare Advantage plans. So we have a good number of people who have the Medicare Advantage plans. Some of the other people have the federal plan. So federal plan, is different. And with that, some people only have to have the Part A as in Apple. So it's a higher number. It's like, well, what about those other 75,000? They could be people who have federal plan, TRICARE for life, and so on and so forth. But about 125,000 with Medicare Advantage plans. What I find with people is, again, they don't understand once you're 65 and you're on Medicare, okay, not working anymore, all you have is Medicare. So you either get it through original Medicare or you get the Medicare Advantage plan where it's embedded in. So those are the only two kind. You can't have all these other insurances. But if a person is still working, absolutely. If they're working, they can still have their employer coverage. Maybe they picked up their Medicare Part A only. Maybe they picked up their Medicare Part A and B. Maybe through a spouse, they have TRICARE for life with the military. Maybe through a spouse, they have, a federal plan. Maybe they have EUTF. So there's so many different ways you can get your Medicare, and that's what makes it so confusing. We think that it's just one way, it's just Medicare, but it's not. It is not. But I love, all the different cases that I've worked on, because that's how I got such an understanding of everything, because it's like, you have what? You have, federal plan, you have EUTF, oh, you work for Punahou and they offer, wait. So I really had an opportunity from over the past 15 years working on so many cases. That's why I know as much as I do. And if I don't know something, I won't speak to it. But I will go find out. So I love that I'm able to I've really helped some people in some really desperate situations. But you're absolutely right. You can't even say, well, do people have like the double covered, over covered? Some people are over covered, but you can't even say, because it all depends on, each individual person and what they have. But I can tell you that you're absolutely right. I just want to share this, and I'm going on with my answer for you. But when you're in a situation where Medicare pays first, okay, Medicare is going to pay 80% for your Part B expenses, okay? So if you have an employer plan that you're paying $1,000 for, then that plan is only responsible for 20%. So some people think, oh, it's a game. I don't want my Medicare. I want an employer plan. But the employer plan is paying so little, it's really a waste of money. And the last thing I want to mention, some people have heard of COBRA, continuous coverage if you leave your job. But the day you turn 65, COBRA pays after Medicare. So some people, they lost their job unexpectedly. I work with thousands of people during COVID, lost unexpectedly, over 65. Oh, I'm going to go on COVID. That's what HR said. But COBRA, not COVID, COBRA pays after Medicare. So those people ended up, again, getting treatment. They think they have insurance. But when it's a big bill, all of a sudden the employer coverage says we pay up to Medicare. The person didn't pick up their Medicare. Even though they're paying a lot of money for COBRA, they were not covered. So I've seen everything. And that's why anyone who'll give me an audience, I got to tell you this stuff. Oh my gosh, it's crazy. And that Medicare potluck, that doctor, it was a dentist. He had no idea he wasn't covered under his wife's plan. Because think about it. She retired 3 years ago. He's carrying the same card in his wallet. Nobody's going to call you up and go, oh, by the way, now that your wife retired, you're 66, you got to get Medicare. No one called him. So he's carrying a card. So the only way he finds out, he gets diagnosed with something, he needs something serious, all of a sudden, you have no coverage. So thank you for that question. Sorry I went overboard answering it, but I'm just so full of this stuff I want to share.
Such valuable information for us. Thank you. And I definitely am going to jump into the chat questions in a second. I just wanted to share from my field, or my experience in my field in psychology. And, one thing that I started to occur to me as I worked more with older adults in psychology is that a lot of folks in psychology providers actually do not accept Medicare. And so they do not accept patients who have Medicare. And as a result, a lot of older adults are having a harder time finding mental health care. And therefore, we're sort of crossing over into this kind of access issue for a particular group of people defined by a part of their identity. And so you get into this social justice issue of age, age predicting less access to mental health care. And I started to see that the American Psychological Association and our state Hawaii Psych Association have advocacy groups who actually lobby the government, because like you said, it's controlled by Congress, what is covered and how much is provided for different services. And so of course there are drives in the government to lower costs, and so there are people who are consistently trying to reduce what things are covered and how much coverage is provided. And so there's these forces that are working behind the scenes to get to maintain coverage and increase coverage. And then, so hopefully Medicare can be more competitive with, previous, other types of coverage so that more people will accept it. But it's just such a complex social issue that goes beyond just health. It's health is political, and so it touches on some very big areas. So I just wanted to, that's what stands out for me in Medicare and my field as like, wow, connected to social justice and politics.
That's right. And of course, that why wouldn't they look at that as a benefit and maybe raise the rates so more people in your profession could take the patients. But I just want to make this one comment. So this is how it helps me. This plan, Medicare, didn't get signed into law until 1965. First cards went out in 66, the former President Harry Truman and his wife Bess. The reason is because Truman was considered the grandfather. He started Medicare or wanted to advocate for it, began advocating for it in the 1940s. What was the life expectancy in the 1940s compared to where it is now? So they never expected people to be utilizing this Medicare insurance program into their 70s, 80s, 90s. I have 4 clients that are over 100 years old. So you're absolutely right. You know, they definitely should do more, but Medicare never thought they would see these numbers. 63 million Medicare beneficiaries, 63 million, and growing every day. 12,000 people a day are expected to turn 65 through the year 2030. So no way did anybody anticipate Medicare insurance would have to be there to cover, you know, all these additional services. But your field is a very important one, very important.
And may I ask, thank you, Lucas and Martha, for bringing that up. But I wonder, thank you for bringing it up about the issue of accessibility that a lot of psychologists don't accept Medicare. But I wonder, and I'd like to hear from the group, whether it's also an issue for physical health. Because I also heard that a lot of doctors just don't take Medicare, even if you want to go in, for your regular physical health.
Well, I can speak to that, and if anybody else wants to jump in, I find that is, there are doctors that don't like some of the paperwork that Medicare Advantage plans require, especially the HMOs. So a lot of doctors, my experience has been patients will tell me, oh, they don't take an HMO, but they'll take the PPO. So I think that doctors' offices would actually sort of empty out because we have so many people over the age of 65 and who are needing to go onto their Medicare plans. So I think the doctor's offices would, kind of empty out if they just said, we're not taking Medicare. So I think that, it's really the type of plan, or if a plan has a reputation for not paying timely. And I think that, yes, a lot of doctors are really upset about the low pay and that, there's a lot of hurdles. But I do believe that doctors are taking about 71% here in the state of Hawaii do take Medicare, but some are not taking new patients, but about 71% do, because I think the offices would start to get pretty empty because the boomers are gaining on those millennials. So somebody's going to have to take care of the baby boomers because the millennials, they don't even see the doctors.
Yeah.
But no, I understand what you're saying. And I've heard a lot that doctors don't want to take it, but some are forced to.
Thanks, Jackie. And thanks, Martha. Yeah, complex stuff and no easy answers, of course. So just going to jump into the chat here. We have about 10 minutes left. Hope to get to most of these, if not all of them. So first question from Alexandra is there a way for folks who missed their enrollment period and are working to know how much penalty they will have to pay?
Okay, that's an excellent question. So is there a way for a person to know what their penalty is if they're still working? Well, I know it's really short, but if a person is still working, they have coverage through their employer, and there's more than 20 people that work at that company, or if a third party negotiates their insurance, like ProService or Altrez, that person actually has what's called a special enrollment period. So they will not incur any penalty at all as long as they sign up within, a certain number of months after they lose employer coverage. People shouldn't be without, so it should be right away. So no penalty for people in that scenario. However, if a person, like the gentleman that we took care of, that did not pick up his Part B on time, he had to wait 8 months. And then the first year, his penalty was 10% of the Part B premium, because he missed it, and that would be for the rest of his time on Medicare. So the way that you would find out is you would call Social Security when you're ready to enroll, and they'll tell you, okay, you can't enroll for 8 months, and this is what your penalty would be. But it's a full 12 months after the time that you were supposed to sign up that you'll incur a penalty. They do give you a 12-month kind of leeway in there, and then once that 12-month period is gone, it's 10% for every year that you should have enrolled but did not.
All right, thank you. Next one from Jackie. Does original Medicare or Medicare supplemental plan cover dental and vision?
Excellent question. Original Medicare, even if you have a Medicare supplement plan, remember Medicare supplement plans cover the gaps that original Medicare leaves behind. So original Medicare does not cover routine dental. So if you had an impacted wisdom tooth, you ended up in the emergency room, the hospital, Medicare would pay, but they do not cover routine dental. Vision, Medicare, original Medicare does not cover a routine vision check. So if you have something, medically going on, oh, it's itchy, red, blurry, yes. But if you just decide, oh, I woke up today, I want to go get a routine eye exam, original Medicare does not cover that. If original Medicare doesn't cover it, the supplement plan doesn't cover it. Some supplement plans are now doing add-ons. So in some states, you can pick up dental and vision as a supplemental and pay for it. But original Medicare does not cover routine vision or routine dental.
Okay, thank you. That's definitely makes that more clear. Sarah asked, can you speak to what is the penalty if a person does not enroll for Part B when first eligible? What is the exception for Part B enrollment penalty when working?
I think you answered the second
You
part
may have,
already.
Yep.
yeah.
Yeah.
Yep. So the penalty is 10% after a 12-month period has gone by, 10% of the Part B premium. So Part B premium right now is 174.70. So 10% of 174 is like 17 bucks. So they would add that 17 bucks onto the 174, and every year whatever Part B grows to, 10% would be added for as long as you have Medicare coverage. And I promise, quick story, I had a call from a guy and he goes, Martha, I have a penalty of $10,000. I said, sir, no way. I've never heard of a penalty that high. So I said, I need more information. So he said, well, I was in prison for 5 years. I didn't pay my Part B premium. And I said, okay, so you'll have a penalty of 10% for every year. So that's 50%. And he said, but I never paid my Part B because when you incarcerated, they take away your Social Security. So we called Social Security, and sure enough, it was $10,000. I couldn't believe it. So I wrote a letter, and it's called, it's a letter that basically says I was wrong, but he kept showing up at Queens Hospital because he was a diabetic, needed his insulin. It was costing taxpayer money. So wrote a letter, 2 months, and Medicare actually waived the $10,000. I couldn't believe it. 2 months, but they waived it. Calls me up, we're both crying, and I said, sir, how did you find me, my name? I never met the guy. He said, oh, at Halava Correctional Facility, we listen to a Medicare Moment with Martha every Sunday morning at 9:30. And I took your number and I thought I would call you if I ever needed you. I was like, oh my goodness, that is cruel and unusual punishment if they make you listen to a Medicare show when you're in prison. But that was how he found me, and it had a good ending because it was costing taxpayers $10,000 a week. This guy kept showing up to get his insulin. So I had to put that in my letter. By waiving it, then at least, he has his Part B, and then he was able to get his needs cared for. So I've worked all kinds of cases. So long story, but yes, that gentleman, you could have a penalty quite a lot, but it's 10% of the Part B premium for every year that you should have signed up, but you did not. If you work and you work for an employer with more than 20, you can work till 89 and you would not have a penalty. You would not have a penalty. And that's why that doctor didn't have the penalty, because even though the insurance was canceling him at 89, we were able to avoid the penalty because he had continuous coverage from 65. But we had to go back. We had to find every statement from an insurance company from age 65 to 89 to prove that he had continuous coverage. So that's how he got out of that penalty.
Unbelievable stories. Just unbelievable. An interesting intersection between sort of criminal justice and social justice there, which is another way that folks
Yes,
incarcerated have a hard time when they come out because of getting slapped with penalties like this, which how would they have known what to do without having
exactly.
found you?
Yep.
And so,
I just have
Really.
one more question because I know time's running out, Lucas, and Martha will know this. Most people don't realize that to get a Medicare Advantage program, you have to still keep your Part B and you have to pay your premium. Is that correct still that you need to? So they think they're getting something for free. In other words, if I
Exactly.
drop my Part B and enroll for Part C Medicare, I don't need to pay my Part B anymore, which is not true.
Yes, we've had that happen, and the person was shocked. They had to run back down to Social Security and get their Part B. And while they were waiting, no insurance, only the A for hospital, no doctor visit. And a lot of people getting treatment run into that, and they're getting radiation. It stops. Yep. Yep. Was there a question from Brandy, Luke?
Yes, sorry. I missed this one, and we have a few minutes left. So,
Yeah.
folks, just want to say that there's the Echo evaluation link that John just posted for folks. But also, Brandy's question: how does a working person who has private insurance and Medicare Part uh, A know which insurance has to bill? Know which insurance to bill
Primary.
as primary versus
Primary.
secondary. Sorry.
Excellent question. And that was in one of my slides. I'm sorry I didn't get to it. But what happens when a person is working and they have employer coverage? If it's over 20 employees or negotiated through that third party, Altrust or Pro Service, then the employer plan is primary, Medicare is secondary. Okay. So the employer plan would be primary. If it's under 20 people and you don't have a small employer exception, then Medicare is primary, even though you have employer coverage. And we have a lot of that going on in Hawaii. And one thing I want to leave everybody with, and I want to give another number, so get your pens ready. Okay, a lot of folks, they leave their employer coverage. Now they have Medicare, but Medicare has not been updated. They go to the doctor, they go to the hospital, they're asking, which is primary, which is secondary? We can't bill. You owe this money. So you have to call the Medicare Benefits Coordination and Recovery Center. Please take this number, 1-855-798-2627. I know it by heart. I call it so much. 1-855-798-2627. Okay. You call that number, and that's how you report to Medicare that I'm no longer working. My employer plan ended. Now I have Medicare. Medicare should be primary. They will make that update. Trust me, if you don't call them and they have it wrong on the system, you will not get your bills paid. Not get your bills paid. And you will
Martha,
not be able to pick up medicines. Yes, I'm here.
may I squeeze in one last
Sure.
question? I'm sorry. What if you stop working, but you're covered by your spouse's insurance because the spouse is still working? And so would the spouse's insurance still be the primary?
Correct. As long as it's over 20 employees at the spouse's work, or there's an exception, you're perfectly okay. No penalty will be incurred. No penalty. Yeah. Yeah.
I
But
wanted to
that
give a shout
coordination of,
out to Martha, but and before we close, right, Lucas, and I just wanted to let everybody know I want to give a shout out to our geriatricians in particular because they do take Medicare, and we need a lot more geriatricians, but we're so grateful for them and some of the PCPs. And Martha can also confirm that they've extended the telehealth coverage through Medicare,
yes,
isn't that right? So that for people living in rural areas, neighbor islands, it's hard to see a primary provider or geriatrician. They can do it telehealth wise, and Medicare will pay the provider.
yes, yes.
Excellent. Well, thank you, Sarah, for that. And mahalo, Martha, so much for this. This is gold as far as
Thank
information.
you. Thank you.
And I'm sure everyone has took a lot from today. Maybe there are more questions. I'm
Part
sure there's
B.
always more, um, yeah, I want to wish everyone a great week. Thank you for joining us today for today's Geriatric Echo. And we hope to see you here next time. So much aloha to everybody. And I got to run. I'm going to be seeing my next Medicare patient, right? And waiting in down the hall. So I
Thank
will.
you for taking Medicare.
Thank you. Thank you,
Aloha.
Lucas, for taking Medicare patients. You're
Yes, yes,
Thank you,
wonderful.
yes.
Sarah.